And fabulous. We're recording. I use any pronouns except he and she in English, and ideally, if other languages have non-binary pronouns, any non-binary pronoun is fine. I mean, not if obviously other languages have them. Tech problems are unsettling. So I'm really excited to be joining you from Missouri today. I just finished 5 years at the University of California, Santa Barbara, where I was the health equity advocate. And that position grew out of direct student organizing. And so as I leave California, I was really excited to be able to partner with this conference to share some of the lessons from that process, going from the level of student organizing all the way up through having a permanently funded multiple staff program that was sort of written in on a really strong institutional level. So a lot of today is going to be participation. This is a pretty small group, so we won't really need to do breakouts, but I do want to start a little bit with program history so that you know what perspective I'm coming from. And I want to emphasize that I'm going to be talking about one thing that I've been doing for the last several years, but this isn't the only way to do things. And people will have different circumstances that require different approaches. So I want to really emphasize that when I talk about what I did and what worked and didn't work about that, I am in no way saying that this is the only solution. So in the spring of 2017 at UC Santa Barbara, there was a queer town hall at the campus Queer Resource Center, which is the Resource Center for Sexual and Gender Diversity. And these happened periodically, usually once or twice a year. And it would often be unpredictable sort of who would be in the room. And so students would show up to talk about their issues, not really knowing who in the administration would be there to listen to them. On this occasion, the people who were there included the executive director of the Student Health Service, the chief of police for campus police, and the associate vice chancellor, or the vice chancellor of student affairs. So we had sort of a health service, campus police, and then the person who was ultimately in charge of health services and a number of other student affairs issues. And students mostly talked about health and policing concerns. And they talked to who was in the room. And it really came organically out of people told their stories about unacceptable care that they'd received on and off campus, how difficult it was to find healthcare. And it was primarily trans students. And it was, I would say even more specifically than that, it was mostly disabled trans students who were talking about not being able to get care, getting care that was not dignified, not respectful, not transparent, not knowing how to get through. There was a lot of gatekeeping for transition care in particular, and students would know that there was a process, but they didn't know what the process was, how long it would take, how many steps it would be. There was just this feeling of somebody else is going to decide, and I have no idea how long it'll take me to struggle through it. So that was a core part of a lot of it. And a lot of it came down to one person who had been set up as the trans specialist on campus and who was giving really poor care to a lot of people. But everyone kept getting referred back to him, even after they had said, like, I can't work with this person. So that was sort of the heart of what was going on, where a lot of it had to do with this one person, but there were also a lot of structural issues that were being identified. And one of the things that came up again and again was that people had complained either directly to the clinic or to advocates at the Queer Resource Center And even though they had complained and complained and complained, every time clinic administration got in a room, they said, well, we're not hearing complaints. And so students were saying, you know, at some point, that's not really our fault. What process you have for hearing complaints is not working. So you need a better system for getting the complaints to where they need to go, and you need to be able to be accountable to that. So I'm attaching a Google link, and this is to a file that is a report that I completed just before I left UC Santa Barbara. And at the very end, let's see, page 73, nope, page 72 has a list of demands and a letter that came out of this meeting. So students told their stories. And then after that meeting, people who had been taking notes during the meeting, including me, wrote down what are the core themes that people keep saying, what's coming up again and again, and then turned those reports of what are the core issues of the community into a list of action items. So what would it look like to address these problems that are coming together? And so we have a letter that says, here is a summary of the problems. I want everybody to, yeah, we could do it that way. That would work fine. I also want people to have this because there's so much else in it, but I can absolutely share my screen. Oh, sorry, I'm responding to a direct message and I must sound very confusing. So, so we ended up with specific demands, and I want to talk through not what our specific demands were, but more the process of generating the demands and negotiating that, navigating that with the administration. So once we had specific demands, we delivered this letter. Well, once we had the demands, we actually had a consensus building meeting where we invited other organizations from across campus who might have a stake in the concern. So any organizations that were trans focused, any that were queer focused more broadly, and then also groups that were focused on other forms of marginalization. So we connected with Women's Commission, we connected with social groups that were focused on human sexuality because reproductive care was such a concern. We connected with local student unions. So anybody who was interested in or engaged with healthcare access along any level, we were connecting with them, or at least trying to get them in the room. And so we ended up with, I think, 10 organizations, and we had a consensus meeting. We fed people pizza and talked through what are the things that matter to us? Do these demands seem correct? Like, does this address the need from your perspective? And then what are the priorities here? What do we most need? What could we maybe sacrifice in negotiation if we had to? And we were able to get a community sense of what folks needed really specifically, and then delivered this as a letter to the administration and started having negotiating meetings. So a lot of what worked really well about these demands is that they were clear and actionable. And I think one thing that gets lost is that often people identify issues, but don't take the next step of identifying specific demands. And if you say, this thing is wrong, fix it, administrators will fix it so badly. They often won't know what you actually need and how to take steps to address it. So being able to say, this is what's wrong, and this is what we want you to do about it, created a much stronger platform for being able to get moving towards what we needed and to identify what exactly we needed. One of the things that was really powerful about this as well was that there were clear roles in terms of who was going to be involved with negotiating and what they were doing there. By chance, we were able to get a couple of people who were on the opposite side of the bargaining table who had a personal investment in what we were asking for. And they were able to help identify some of what we needed and validate some of the descriptions of what was happening. And that helped a lot. So I think if you're able to engineer that, I've used that more intentionally after that with a lot of success, that it's really helpful to have someone on the other side of the table who's really on your side. And trying to get through accountability, setting up structures for specific expectations. So one of the things that I want to start with is thinking about who's in the room today. And since there are really few of us, I want to encourage people to turn on their camera and introduce themselves vocally, but if you don't feel comfortable with that, putting into the chat is also great. I'm really interested in where you're coming from in California or somewhere outside of California, and what went really well for you in a healthcare encounter that was good. So if you think about like the best healthcare encounter you've ever had, what was great about it? And I will start to give folks a minute to think. So like I said, I'm Han. I'm calling from St. Louis today. And one of the best healthcare encounters I've ever had, one of the things that really was amazing about it was that the provider immediately took seriously a condition that is often dismissed. And so when I said what I have and why I was seeking care, I immediately could tell from her demeanor that that she took it as a real problem and was not dismissing or undermining me at all. And that was really valuable. So is there someone else who's comfortable sharing?
This is Sasha Rang. Actually, I'm a nurse myself, and actually I am the board member of the Philippine Nurses Association of Southern California, and also the board member in the national scene for the Philippine Nurses Association of America. And when I was running for the position, I actually put diversity, equity, and inclusion as one of my platform. And I get to meet one of the running candidate for assembly person here in California, Dr. Mary Tehari, who's also a nurse. And I invited her during one of my presentation because I created a presentation within our nursing organization about diversity, equity, and inclusion. And we were talking about LGBTQ issues. But it was not enough, of course, for us to understand exactly what are the issues, especially in the transgender community. I myself is a transgender woman, but a lot of the things that are being discussed, like being bullied or being having difficulty accessing medical issues or medical services have not been experienced by me, because I think the reason is because I knew where to go. I know the resources of being a nurse and being in this kind of healthcare industry. So, but I really applaud you, Han, for having the opportunity to actually lead this opportunity for everyone, that you actually help them out there to succeed in what they need. UC Santa Barbara, that's kind of awesome up to that. It's sad that there were some experiences like that to some of the transgender people out there. But my plan as a public official for the nursing association organization in both local and national, is to really help out LGBTQ issues. If we could actually support like a white paper, if there's anything like that, that we could actually put into support a policy put together. So that's where I'm coming from. And of course, and locally, I really would like to join any organization that actually have issues with regards to transgender health. So I could actually be part of that and be able to help. So we're here. I'm here to help actually, since I'm part of the community, but I'm not very active in terms of like social networking. And so that's why I'm trying to start with that one. So far, I hope that this participation today is going to be valuable for everyone, including myself, so that I could help people. So that's my intention of joining today. So thank you, Han.
Awesome. I'm so glad you're here.
I'll share. My name is Jacob, he, him, his pronouns. I'm the CEO and founder of QueerWorks, a 501c3 organization located in Coachella Valley. We provide completely free mental health care services. We have about 200 trans and non-binary clients receiving free therapy. I'm a licensed marriage and family therapist. Right now, we just launched planning phase for universal basic income pilot out of Palm Springs as well. So we're doing a lot of stuff within the valley, within Riverside County in general. So I'm just kind of trying to see what the climate is throughout California. My main goal really, for honestly, to be transparent, is to see where funding is, to see where money is, because we need to continue to provide these services for free. And the only way that I can do that is by paying my staff instead of my staff having to charge clients. So yeah, just trying to figure out ways to keep our mission going, and to keep that, keep doing what we're doing. Yeah, so as a trans individual myself, I came out at 14, and I just been through every type of healthcare professional as a trans person. So I kind of understand, right? Like, I understand what's good and what's bad. I think a great encounter is the provider doesn't have to be identified, the same as me. They just have to be open to listening to me and knowing that my needs are, when I talk about what I'm experiencing, then that's true to me and that's valid to me. Sometimes doctors are like, no, it's X, Y, and Z. And I'm like, no, you don't understand. Like, I don't have a prostate. Like, how many times do you have to say that? Or like, no, you don't understand. Like, this is having to do with, my hormones are off, and like, I'm trying to, I don't know, regulate my hormones after hysterectomy, and I don't know what to do. And they're like giving me facts that are for cis men. So just people who recognize and see and don't have to constantly be reminded that I'm not cis, that's always what makes a good healthcare experience for me. So yeah, that's me. That's where I'm coming from, and happy to be here.
I'm glad you're here. I think somebody came in while we were doing introductions. So what's happening right now is a optional introduction of who's in the room, where we're each coming from, and what makes a healthcare encounter really good for us. And folks should feel free to speak up or put something in the chat if that's more comfortable. All right.
Yes, I guess maybe I can go. Yeah, I'm Angela Soto. I'm with the Imperial Valley LGBT Resource Center. And one of the things that makes it easy for me when it comes to getting good health care is just good manners. Just being polite and respectful when I see that I do encounter somebody, where I can be honest. I had an encounter about last year where I was getting prepared for surgery, and I was asked the question, will I be needing to have a certain type of healthcare that is more geared for a cisgender woman? And I was able to tell the nurse, listen, that will not be necessary because this does not necessarily apply to me. And the nurse was very professional. I let her know I'm a transgender woman. I have certain conditions that I'm dealing with, and I don't feel that's necessary for me. And they took it very well, and I was able to avoid having her, get that gear for me in my case. And, that's a very professional encounter where I felt I could be honest, and I got a professional response, and they appreciated it. And it was good for me. I was able to move on. But within the same facility, the professionalism of that one nurse was very good. And then I also had a situation at Keck Medical Center of USC where there was a situation with an orderly who they were able to look into my private area. The curtain was not drawn and they were doing their job. And then it was his job to take me to do radiographs. And he had a situation there where he called me a corrupt one before other staff. And I was like, whoa, I was really taken aback by that. And I felt humiliated and frustrated. And that's with me knowing my rights. I was so shocked that I got shocked into not doing anything about it. I kind of just let it go, but I was really, the professionalism of the one nurse was very good, but within the same place, sometimes you encounter other people who are not properly trained. They don't know how to do, the pronoun usage. If they see something that's a little unexpected or, non-traditional, when it comes to people's transitions, they just need more training, I feel, and what to do when you have a situation like that, the grievance process, to be able to report on instances of lack of professionalism. I've experienced it myself, so I can see how it's very important for others to be able to have that follow through. Why was I treated this way at this facility? So yeah, those are good questions for everyone to know. What recourse is there to correct that? What follow through is there? If the complaint is filed, will it just fall by the wayside, or will there be a consequence, or at least be able to direct the offending party towards being more educated?
I'm so sorry that happened to you, and I really appreciate you sharing that story. And you bring up some really important questions. What happens after a complaint? How do people know what happened or what they should do if something goes wrong? And I think that the things you talked about in terms of feeling shocked and feeling like, even though you know what to do rationally, in that moment,
Right.
It's so overwhelming. I really identify with that as well.
And yeah, there's and like within that too, there was a situation where I was having a situation with a urinary catheter, and the nurses were like, do we call a gynecologist or do we call a urologist? And I was like, I'll stop you there. in my case, I'm a transgender woman. I do not need the gynecologist. A urologist is fine. You know, so there's situations like that where the professionalism is there and they're very respectful. And then there's people who are less trained down the line that can really, you know, possibly bring people down. And that's because of ignorance, because of lack of education, lack of training. And, but yeah, definitely that was kind of like a black spot in my healthcare with them. But I know not to judge the entire organization just because of that one instance. And then also, I just kind of chalked it up to, you know, the person's ignorance. I did, you know, I don't want anybody to get necessarily fired or anything like that. But then again, I do think by me not reporting this, another transgender individual or gender variant individual may be subjected to that. So it's kind of like one of those decisions. What do you do in a situation? How do you proceed?
Absolutely. And that really gets at something that I saw throughout my time at UCSB, where trans people wanted to speak up because we all, you know, when we have an experience like that, we want other people to be spared from having a similar experience, but punitive approaches aren't effective, and they often aren't a good fit culturally for what we want. A lot of us, I think, are really looking for constructive and reparative strategies that just fix it. Like, we want a transformative approach. We just want the harm to stop happening. And often HR departments are really oriented towards a punitive kind of system where somebody gets in trouble or nothing happens. And so we see that all the time. And once I was in the advocate role, I would very often have people come forward and they were very willing to disclose their own identity, but they kept the identity of the person who did harm a secret. And they wouldn't tell me who was involved with the encounter, specifically because they didn't think that it would be helpful to have that person get in trouble. And so it's something that's so important for systems and for administrators to be aware of, is that, like, we need systems of accountability that don't look like punitive systems, that don't work like that. I'm seeing a comment in the chat. I can't unmute right now. I'm in Marin County, which is in the North Bay part of the Bay Area, training institute manager at the SPAR Center, which is an LGBTQ plus nonprofit. I had top surgery in March, and I was very grateful to have a very gender affirming experience with staff. They got my pronouns once, but other than that, they made me feel super comfortable physically and honored my gender and celebrated it, which is awesome. And congratulations on top surgery. I think this is a good moment to start transitioning towards thinking about problems. You know, we talked a little bit about what works really well for us in healthcare, and Angela points out that, yeah, often thinking about what has gone really well also brings up these, like, what did not go really well. So keeping in mind that this is recorded, so I don't want to pressure anyone to disclose anything that doesn't feel comfortable, but feel free to throw out either verbally or in the chat things that you've experienced, things that you've heard about in your community that have come up in other organizing contexts, things that clients or service users have reported to you. So I don't want to make anyone feel like they need to disclose personal traumas, but what's not working in California? What do we still need? One thing that I've seen is increased carelessness with regards to how people are doing client education or patient education with trans people. I've talked to a lot of trans people who use injectable medications for their hormones. who were never told that they should be using an alcohol swab. And so these patients are at higher risk of injection-related infections. And particularly if somebody is using, you know, a 10 milliliter vial of testosterone over a course of several months, that injection risk becomes pretty considerable if that person is not keeping that bottle clean, is not sterilizing at the point of injection. So that's something that I've noticed.
I could,
Hello.
oh, sorry, go ahead.
I'm so sorry. It's Sasha here. I'm so sorry to hear that because as a nurse, definitely our training is to make sure that we can provide the safest type of care to anyone. But of course, when you go to a clinic, not everybody is as educated to the level that they're supposed to, and that is a fact. So therefore, we have to be very careful. And if we see as individual and we know, we could actually point that out right away to this healthcare worker that that is not correct. But I know for a fact that the purpose of client education or patient education is to make sure that they are aware of what really is important, but of course not knowing what is important. For example, alcohol swab, swabbing the vials before you actually insert the needles and then injecting the area, and you have to clean it with an alcohol swab as well. It's not everybody's knowledge. So therefore, what we need to do is therefore create a protocol in our own clinic or hospital, which is already in there. There's a lot of organization actually that is basic. It's not even about being a transgender or in the LGBTQ. It's a basic necessity to support safety. But what is important is to talk to the manager if you see things like that. Manager at the clinic, don't be afraid, because as a nurse myself, and I'm a transgender woman myself, I advocate that we need to support everybody, not just LGBTQ. Everybody has supposed to receive a safety and quality care out there. And for Angela, you mentioned about your experience with KEC. That is a little bit. I have friends, and they don't worry. They're part of my group. They're part of my organization. Some of them are, and this could. I'm not going to mention your name, but I will mention to them that they need to start working on promoting LGBTQ health to the forefront, because it is important. I myself is with Kaiser Permanente. That's my insurance, and I go there for my trans health, and I don't experience anything unusual than being professional. So I think that not everybody yet are still educated about our needs. So therefore, I would go ahead and advocate for you guys to that, so that we could create more education to all of these hospitals, organizations, clinics, to promote LGBTQ education. So if you need anything, let me know what particular idea needs to be educated out there for people, especially nurses. Because I'm creating research, actually studies at this point, wherein what's the perspective of a transgender woman with regards to the help that they are receiving. And policy is actually supported by data. And as a scientist myself, we always go with the data. What is the data talking about, saying about? Do we have this kind of phenomenon? So how many people are experiencing this? If we have those, then we could show to the policymaker that we need a change. It's not all about just talking. We have to have a support, a data. And if we could have that, and that's my plan actually, is to continue exploring more, because there's very few studies with regards to transgender, and especially people are actually snatching the fact that they are not transgender themselves, but they are actually talking about transgenderism, and it goes all over the place. It's not like what are the needs of transgender people. And so, guys, if you can help me, okay, one of these days I will be reaching out to you guys, so we could actually create data, we could impact policies. Now that I am with the organization that actually for nurses, that we could actually do something about this. It's really important. Thank you.
Yeah, it absolutely is. And I want to, again, since not everybody was here when I shared this before, the link, um, the Google link that I've shared is the report from the program at UC Santa Barbara. So this is a study of healthcare experiences at UC Santa Barbara. That was a mixed methods study of about 250 participants. So it also, the citations could be really helpful for you in terms of connecting with research that's been done on this topic as well.
Thank you.
Absolutely. Jacob, I think you were going to share something
Oh, yeah.
about, yeah, current needs.
Yeah, I think it's something we don't really think about, but then I I think there's like organizations that are overthinking how to be inclusive, or they're, I don't know, are they are underthinking. So I'll give you an example. I get kidney stones pretty bad. And so I went a couple weeks ago to an urgent care out here in the desert, and desert it's like really queer friendly, but I wasn't really afraid of my safety or anything. But when I got there and I told them that I was having a kidney stone, they said, okay, great, like you need to go in and do a cup sample, right? Like you have to be in a cup. And I was like, cool, I've done this a million times. And so they handed me the cup and a bag, and it had like printout instructions on how to take the sample. And the very first thing that it said was wipe the tip of your penis. And I was like, okay, great of them to assume that I have that, right? I was half gonna make a joke and walk out and be like, I think we have bigger problems because I can't find mine, but I was like in too much pain. But it got me thinking, like, okay, so what would be the solution to this problem? Well, a solution could be like, which one do you want? Like, which instructions do you need? But then that could be potentially outing somebody, right? If they go, oh, actually, I need the pink paper, not the blue paper. And then I was like, a really simple, easy solution would have just been to put all of the instructions on one piece of paper and hand the cup. Um,
That's what we
and so
did at UCSB.
yeah,
And
right. Easy.
yeah, just,
Not that hard.
and one of the things that we ran into was that they had been handing one wipe to men and 2 wipes to women. And so they said, if we don't know which instructions they're going to follow, how many wipes do we give them? And they solved that by just putting a wipes dispenser in the bathroom.
Right. Like
And
easy.
so completely simple. I think they also ended up putting the instructions on the wall of the bathroom that they were using. And so it was like, take the number of wipes that's appropriate and follow the instructions that make sense for your body. We don't actually need to know which thing you're doing. It all ends
Exactly.
up the same. So yeah,
Yeah.
absolutely.
And it's like, my thought is like, what are we doing wrong is sometimes we're overthinking a solution, or sometimes we're just not even thinking about an obvious solution. And so I think we're often caught up at the most extreme. So, oh, we have to make sure everyone's this, and that's great. Like pronouns, all that's great. But then it's like the small things that are missed that actually create the big problem. So I would love to see more of the sort of just simple solutions. Like, it doesn't have to be a big party to get my urine sample.
Definitely. Throwing this out, since this is a thing that I've been struggling with a lot in my work, electronic health records programs are often not supportive of the kinds of information that we need to gather. For instance, if you've got somebody's health record on a piece of paper, you can write whatever name you want on it. But if everything is on a computer system, which of course we now have, everything has to feed correctly from different data sources. And so how do you make sure that a person who hasn't changed their name legally can still be called the correct name when they present at the front desk? How do we manage data when somebody might be legally non-binary, but it says male or female on their insurance card? How do we handle it if somebody, how do we know which person to send a reminder to for their prostate exam and who to send a reminder for a gynecological exam? So handling information systems is an ongoing problem and one that the AMA has made some recommendations about, but that have not gotten picked up because those recommendations are voluntary. So thinking through, we've got a couple of things in terms of what's going wrong in our care right now. And we don't need an exhaustive list because this is just getting us started. But so some of the problems that we know about are complaints kind of going nowhere. Patient education not meeting standards. Inappropriate or disrespectful language. Staff not being adequately trained, not expecting encounters with patients like us. Overthinking, overcomplicating needlessly, and unsupportive information systems. So just starting with that, I encourage everyone to choose one problem that they're going to think about for right now. It could be a problem that you suggested, it could be a different problem, but just pick one. And we're each going to spend just a couple of minutes free writing, so you can jot notes in pen like I do, or type them up or something. And just I'm going to set a timer for 5 minutes. And the questions that I want you to think about your one problem. How would you like to see this solved? So how would you solve it? Who else experiences this problem? Which Dr. Sasha hinted at earlier. What impact would your proposed solution have for that group? So for instance, my clinic was trying to figure out how to handle online triage for UTIs, because the question that underlies this sorting mechanism is, does the person have a penis or a vulva? Because if the person has a vulva and they have UTI symptoms, usually in our population, they have a UTI. And if they have a penis, usually in our population, they have chlamydia. And a UTI, an uncomplicated UTI, can get treated by a nurse practitioner, but chlamydia usually gets sent to a doctor at this clinic. So they had originally been asking, what is your gender? But that meant that people might get sorted in the wrong direction, and that could cause really dangerous delays if it was a complicated UTI, or if it was, I mean, if it was chlamydia, it probably wouldn't be super dangerous, but you wouldn't want the care to be delayed if they got sent to the wrong place and then had to make a second appointment. So we had to think through, how do we ask this question in a way that's appropriate, that's approachable? And then we were thinking through who else is affected by how we solve this problem. One of the things that we thought about was, what's the knowledge? Because the doctors were thinking, well, how long is their urethra? And we went, well, we're not going to ask patients, how long is your urethra? Because some of them don't know what a urethra is. So we can't ask them that way. So we were thinking about, what kind of language do people have? What kind of body knowledge do people have? What question can they answer that will also be accurate? And ultimately where we landed was, do you have a penis or a vulva? And so that was the question that we could ask, that we were confident that people would know. And we had to think about who all is affected by this solution as we decide what approach to go with. And the last question is, okay, so what impact does this happen? Does your proposed solution have for the other group? And if necessary, is there another solution that might fit both? So pick one of the issues, the problems that we've talked about so far, and I'm going to set a timer for 5 minutes, and then we'll gather back and chat about what we've thought about. All right, that is our 5 minutes. So what did folks come up with? How should we fix our problems?
Hello, Han. It's Sasha here. Can I start?
Sorry, I couldn't hear you for just a moment. Sasha?
Yes. Can I start?
Absolutely.
Okay. I think as a nurse myself, one of the issues really, and it's very good that it came up, is the use of electronic health record with regards to identifying, of course, the gender of the patient when it comes to specific nursing care or treatment. Because the question that you have is first, how would you solve it? I think a hospital or a clinic should first make sure that there's a policy when it comes to inclusivity to about patients out there, about the community, and they have to be aware about the LGBTQ and the policies that are already existing. That they need to make sure that the information should become inclusive, including the use of electronic health record. So they have to put every single type of agenda out there. In one of the clinic experience I had, instead of putting everything, they just put in there, what is your birth sex? Because some of them still are not in after surgery. They have not had a surgery yet. So therefore, that's how they will determine whether they're going to have a vulva or a penis. So anyway, if someone actually like a nurse would see that there is a definitely different other than binary, male or female, it would help. And then they could actually put in their notes because the drop down, if the drop down menu is limited, they could actually put one area wherein you can put annotation. It's usually almost like that all the time. I haven't experienced any situation wherein you cannot actually type in a note in the in your electronic health record. There's one area that says note. I think it has to be inclusive though, to all types of notes out there or documentation so that everybody can, that's the real meaning of inclusivity, is to have that. So you have to contact the application, the engineer who's actually creating your electronic health record for that. Who else experiences this? Everybody, doctors, nurses, any members of the healthcare facility would experience that. What impact does your proposed solution have for it? Will really make the life easier for everyone, and we could prevent offending every type of individual out there: male, female, transgender, male, non-binary, everybody, because of the opportunity to actually put out in there, okay, I am this, and this is how I go by. And so we could determine also what kind of care should we provide. And then the last one is there another solution that might help, or both? I would think that this is a very practical practical situation actually. The only thing is we are missing something. It's because again the community at large is still not used to the LGBTQ population. We are out there, they know, but for some institution they are not yet LGBTQ friendly, I would say. So therefore, by teaching them and starting with a policy, again, it goes back to the policy, because if there's no policy, nobody will act on it. But if there's a policy, then people will go ahead and start acting on it, and they could create guidelines. And that's what I do, because as a dean of nursing, in order for my faculty to actually address the needs for LGBTQ students, I have to start with a policy. How are you going to make sure, for example, addressing the person in class, just like that? Some of them are still not actually transition 100%, so they're still using original name. But if you look at them, I have one student actually, and she said, "Call me she."
she kept repeating that to the faculty because the faculty, when they're reading the attendance, they said, Mr. Like, no, 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 no. You have to address her as a she because she is now officially a transgender. Unfortunately, her name is her name is not yet changed. So yeah, those kind of have a policy that people could see, that could follow, it would really help a lot. But I would go start with electronic health record. Thank you.
Absolutely. I love that you brought up that there's the policy side and also the tech side. I just realized that we are running short on time. I want to make sure that I've shared this before we go, that when you're going into negotiating, I want to remind you to work with pride. Who has the power to respond to the thing that you want to talk about, so that the right person is in the room and they can actually take the action that you need? What resources are needed? How long will it take? How much money will it take? If you're prepared to think through that, at the moment, other important resources, what kind of knowledge is necessary? What kind of expertise? What issue does this address? So what problem are you trying to solve? What is the specific demand of the people who are affected? So the problem and then the solution. And what expectations can be agreed on regarding timeline and accountability? How will you know that this has been solved? When will you be meeting next? I would say if you go into a negotiating meeting, don't leave the negotiating meeting without another one set up. Know exactly by when things are going to be acted upon. And if that timeline gets pushed back, there should be visibility of that. Why has it been pushed back? Why has it been deprioritized? One of the things that I ran into as a challenge with my program was that there were a number of times in my first couple of years where my funding went into question. And so instead of doing the work of health advocacy, my job became trying to figure out who I needed to convince that my job mattered. And one of the times that happened was at the beginning of the pandemic. And the impact of that was that at the moment that the pandemic was just starting, instead of trying to kind of shove my foot in the door to make sure that our pandemic response was keeping in mind health equity concerns, I was needing to convince people to continue funding my program. And that did not serve my constituents. That's not what we needed as a community. But this is the kind of thing that I recommend thinking through is who needs to be in the room, like I said, who has the power, what resources are needed, what issue, what demand, what expectations. And having a clear sense of those as separate but very interrelated entities as you're moving into advocacy. And advice that I got very early on that was really, really useful to me was don't reinvent the wheel. I think that particularly for trans folks, it can feel very, very isolating. It can feel like we're the only ones doing the work if we look around a hostile clinic environment. And it feels like we're the only one doing the work in our local moment. But there are other people who have done this before and who can bring insights about what solutions work, what solutions don't work, what there could be pitfalls or unexpected costs to. And building on the successes and knowledge of people who have been doing the work in other places and for longer is really, really valuable. So I want to open up just the last 5 minutes. If there's any questions, I'll also put my email in the chat if anybody wants to reach out to me. So yeah, are there any parting thoughts or parting questions?
Yes, I want to thank you, Han, for your discussion on this issue. I feel that sometimes when it comes to these approaches, just like you mentioned, with being specific and using simple terms that people can understand, that will help people get that health care, because at the end of the day, that's what people want. And if you let people know and the healthcare providers are able to work with that simple language, like, do you have a penis or do you have a vulva? You know, that's so that the patient will have that tailor cared, care package, so that, they're able to get through the help that they need, and trying to avoid some of those morbidities, delays in healthcare, which can be detrimental, and to have a more positive healthcare outcome. That's what we want at the end of the day for everybody. So
Absolutely.
as a former UCSB student, I attended there between 2001 and 2003. I was in my pre-transition days, and I was there in hiding. So yeah, I'm glad that you were at the forefront of, having, made those changes out there. Thank you.
Thank you. And there were a lot of us, and there were a lot of people who were really involved. I've been really blessed and really fortunate to be able to lead this program, but it certainly was not just me, and there have been a lot of people involved over the years.
Thank you.
Thank you. Jacob commented in the chat that there's also such a need for our own community to engage in training and development so we can grow with our providers, and that's absolutely true. And I think often it's such a double-ended sword, where sometimes we have so much more knowledge than our providers, and sometimes we have so little knowledge because of things like accessible and appropriate sex ed that's so lacking for trans folks. All right, I think that we're wrapping up. Thank you so much, everyone, for joining me and for bearing with us as we had Zoom issues this morning. I hope the rest of your day